Hi there, you're welcome to DemiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a subscription gift to you, we would like for you to download a free meal recipe that we do have here at DemiRx Care. So go ahead and click on the link down below in order to be able to download or view that. Thank you so much for watching and stay tuned. Hi there, so we're going to talk about medication known as Celecoxib, which is also known as brand name Celebrex. So this medication have probably been mentioned due to patients having like an ulcer or a stomach related condition. So usually this medication will be prescribed to you by your provider due to pain or migraine or osteoarthritis. Also, patients may take this medication for gout. They can also use this medication for menstrual cramps as well as rheumatoid arthritis and a condition known as ankylosing spondylitis, which is kind of like a fusion in the bones that are in the spine area. All right, so this medication comes in capsule and it also comes in solution as well. So the normal doses that patients will take in terms of oral tablet will be 100 milligram twice a day or about 200 milligram twice a day. So those are the common doses. This is not to say that some other patients don't take a higher or a lesser dose. So in patients who have migraine, usually the recommended dose is about 120 milligram as the maximum dose in 24 hours. In patients who have gout, this medication will be given as a 800 milligram only for 7 days. So usually you want to use this medication for just a shorter period of time because of the cardiovascular or heart side effect of this medication. So which brings us to the side effects. So this side effect of this medication include hypertension. So this medication has a lesser side effect on the stomach. So usually the doctor will prescribe in patients who have an ulcer. But the downside to that is that this medication can also cause some cardiovascular condition or worsen them. Because of the medication itself is a non-steroidal anti-inflammatory medication, usually this also affect the cardiovascular areas of the body as well. So with that being said, like I said, with this medication you might notice a spike in your blood pressure. Also, this medication can cause diarrhea, it can cause headache, it can cause stomach pain, it can also cause dizziness, it can cause indigestion, it can cause stuffy nose, runny nose, as well as cough or any upper respiratory infection. Also, this medication, patients may notice anemia or like an anemic feeling. Patients may also notice like black, red, tarry stools. If you notice this, then you definitely want to reach out to your doctor immediately. That way we can ensure that you're not having some stomach bleeding that's going on. Also, patients may also notice an abnormal vaginal bleeding. This has been reported in patients, but like I said, if you notice that bleeding side effect, then you definitely want to reach out to your provider immediately. That way they can evaluate and make sure that this medication is still appropriate for you. All right, so what are some serious urgent side effects you definitely want to reach out to your doctor for immediately when you start noticing them? So patients who have stroke. So if you start noticing any stroke symptoms, you definitely want to reach out to your doctor, and I'll include that stroke symptom in this video. That way you can see those kind of stroke symptoms that do occur in patients. Also in patients of heart failure side effect, maybe like water retention in your lower limb area. If you start noticing that more often than normal, you definitely want to reach out to your doctor regarding that as well. Also, if you start noticing any ringing in your ears, any abnormal heartbeat, or any hearing loss or chest pain, then you definitely want to reach out to your prescriber immediately. That way, like I said, they can assess and make sure that this medication is appropriate for you. All right, so what are other things that you want to know about this medication? So because this medication has more of a lesser side effect on the stomach, it can be taken with or without food. So some patients may still opt to take it with food in order to avoid any upset stomach, but compared to medications such as ibuprofen, which are also in the same medication class as this medication, patients don't have to take it with food. Also, if you do have any allergic reaction or if you have allergies to NSAID, drug class name NSAID, which is the non-steroidal anti-inflammatory drugs, or if you have any allergic reaction to sulfur, you want to make sure that you're talking to your doctor immediately, because this medication is classified as a non-steroidal anti-inflammatory drug. All right, so you want to make sure that you're also taking this drug with a full glass of water. Also, you want to make sure that if you do become pregnant, this medication should be avoided starting 20 weeks of your pregnancy. It is not recommended to take this medication along with medications such as ibuprofen or naproxen, because these medications are in the same class, so it will kind of, feel like you're taking two of the same medications together, even though the ibuprofen has more of a side effect in the stomach area. All right, this medication should also be avoided in patients who are having gastric bleeding. So if you do notice any form of stomach bleeding, or if you have a history of stomach bleeding, this is not going to be an appropriate medication for you. So most likely we're going to have to opt for another pain medication such as Tylenol or other medications that can help, reduce that pain that you're feeling without really affecting your stomach. Also, in terms of the capsule that this medication comes in, you do not want to chew this capsule. If you do feel the need that you cannot swallow the capsule, you can open up the capsule and actually put it inside an applesauce, a spoonful of applesauce, and you want to make sure that you're swallowing that immediately. So you don't want to take more than 2 doses at the same time. So if you're supposed to take 200 milligrams twice a day, you don't want to take 400 milligrams instead. So you want to stick to the 200 milligrams. After 12 hours, then you take the next dose. So because usually this medication is a twice a day dosing, you want to make sure you leave enough time in between each dose. Also, with this medication, the doctor may prescribe it for a short period of time, so make sure that you're only taking it for that short period of time in order to avoid any further or any serious side effect. With this medication, patients have noticed that they may bleed more easily, so you want to make sure that you're careful and avoiding any injury, making sure that you're using a soft toothbrush as well, or an electric razor as well, in order to avoid that easy bruising or bleeding while you're on this medication. Also, you want to make sure that you're talking with your doctor before you drink any wine, beer, or any mixed drinks while you're on this medication. All right, I hope I was able to help in terms of what to look out for while you're taking this medication. Like I said, this medication is used for various types of pain, such as gout, migraine, osteoarthritis, menstrual cramps, rheumatoid arthritis, or ankylosing spondylitis. So if you do have other conditions that are pain related, this medication may be prescribed to you, most especially, like I said, in patients who have a history of some gastrointestinal or stomach disorder. Doctors will usually opt for this medication rather than ibuprofen, which has more side effect on your stomach. All right, thank you for watching, and make sure you hit that like and subscribe button down below to support us here at DemiRx Care. If you have any further questions regarding how to take this medication, you can check out our website at www.DemiRxCare in order to talk to a medication expert or healthcare professional regarding any inquiries, concerns, or questions that you may